This is a reading of the Doctor Diaries, What Physicians Wish Patients Knew, from the June-July 2018 issue of AARP Magazine by Dr. Joanne Jarrett. Joanne Jarrett, MD, polled dozens of doctors to find out what they'd tell you if only they could. 1. We are working on your case, even if it looks like we have disappeared. Physicians often forget how scary being in the hospital can be. Rest assured that when the doctor is not at your bedside, he or she is writing up your evaluation, the plan, and the orders outline what needs to be done for you, all the while checking for test results and recalculating the diagnosis and plan. You may not see him or her until the next day, but your doctor or the physician on call is available by phone continuously to address your concerns. 2. When we keep you waiting, it's not because we think our time is more valuable than yours. But if the patient before you mentions blood in his or her stool or talks about suicidal impulses, your appointment needs to wait. Your best bet is to schedule the first appointment of the day. 3. We need complete honesty from you. This means telling us what drugs you've taken, legal and illegal, so we can help you avoid interactions. It means answering honestly about sexual function and behavior, even if you fear we wouldn't approve. We think no less of patients who struggle with mental or emotional issues. 4. We know lifestyle change is hard and boring. We try and fail often ourselves, but sometimes diet, exercise, and/or alcohol abstinence really are the best treatments. 5. Many of us have post-traumatic stress disorder. I have nightmares about patients down in an infinite hall, each with a problem worse than the last. In my short career, I've seen a baby take her last breaths. I've watched a woman bleeding uncontrollably after giving birth lose consciousness as I worked, a pool of her blood expanding at my feet. I've heard a woman, after having both legs traumatically severed, saying goodbye to her father, assuming she wouldn't survive. I could go on. We know we signed up for it, but keep in mind, when you're tempted to be angry with your doctor, we are under stress too. 6. We wish we had better advice for weight loss. Medical schools don't spend much time on nutrition. Although body weight has significant holistic health implications, the field of medicine is at somewhat of a loss here. Our best advice, however vague it may be, is to increase your physical activity, avoid processed foods, and eat vegetables at most meals. 7. Sometimes the internet is right. There, I said it. You can find useful health information online. We love a well-read, inquisitive patient, and we'll be happy to touch on any of your internet-fueled fears. Just be careful. The internet can lead you to unnecessary panic or to dismiss something that shouldn't be ignored. And be wary of discussion boards. Incorrect advice can be very convincing. Remember, there are no substitutes for medical training, experience, and complex analysis. 8. We know you've answered this question already, and we're sorry to ask it again. When you call for an appointment, you're asked what's going on. Then, when you're checked in, you're asked again. So when you finally get to see the doctor, you're sick of the story. But we can't help it. We have to hear it with our own ears. 9. Yes, some of us are jerks. Most doctors mean well and are doing their best, but if you're not getting a sense that your physician, although human and harried, has your best interests at heart, find one who does. 10. We worry about you. We lie awake, worried sick about you more often than you'd imagine. We may wonder about you for years after you leave our care. The stakes are so high, and we know it. 11. We make mistakes. Our fear of screwing up is exhausting, weighty, and ever-present. It's the hardest thing about doctoring. We do make mistakes. Be wary of anyone who won't admit that. 12. We want the very best for you. Just know that. It's the bottom line. This has been a reading of The Doctor's Diaries, What Physicians Wish Patients Knew, from the June-July issue of AARP Magazine by Dr. Joan Jarrett. This article reading was brought to you by Women's First OBGYN in Chesapeake, Virginia. Call now for your gynecology or wellness consultation appointment.